Sarah, we've heard a lot about harm reduction lately. Can you tell us what it means in simple terms?
When we talk about things we do in everyday life, there's always risk to it. So driving a car, there is risk of harm if you crash, which is why we put seatbelts into cars. So if you take harm reduction, or that concept of harm reduction, into drug use, what we're doing is we are not condoning or condemning drug use, we're accepting that it happens. And what we're doing is putting measures in place to reduce the harm that can happen from that drug use. So Paul, where do you see harm reduction in Victoria heading? Are there new strategies or tools we should be excited about?
There's a number of strategies, Sarah, under the Statewide Action Plan that's being rolled out by the government. We're looking at increasing people's access to the medications that can help to reduce the harms related to opioid dependence. We're increasing the access to naloxone, so the antidote to opioid overdose, in the general community, looking at having some vending machines around for people to be able to access very freely. We're working on the early warning system, and surveillance, so we're working out what drugs are out there in the community and being able to provide alerts to people so that they're aware of what might be happening. And then we've got the very exciting process of drug checking that's happening at festivals and at a fixed site coming up soon.
What's your take on why it's so important for us to talk about harm reduction openly?
Well, I think we need to talk about harm reduction openly because we need to live in the real world. We know across society about half of the population, adult population, will have used an illicit drug in their lifetime. 1 in 5 will have used in the past year. And so we need to be working with acknowledgement that is happening and helping people who are doing that to be doing that in as safe a way as we can possibly arrange.
And if we talk more openly about harm reduction, we reduce the stigma and discrimination that goes with it, which means people feel they can speak up and ask for help or support or just advice and information when they need it.
So, Sarah, we had our first mobile pill testing trial at a music festival. Can you tell us how it works? Do I just hand over a pill and then wait, or what's the process?
The first thing that's really important to know is it's not just pills. We more colloquially refer to it as drug checking because that really encapsulates a range of drugs that we can test. So that's pills, powders, liquids, crystals, things like that. First of all, they actually sign a disclaimer. They'll then sit down with a chemist, and the chemist only needs to take a really small sample of that drug. So it's about the size of a matchstick head. They'll ask a few questions about what the person believes that substance to be, whether they'd tried it, whether they've had any unexpected experiences, them or their friends. The person will then either wait whilst we test the sample, or in a festival setting, they'll often be given a unique number that links them to those samples, and they'll go away and come back at a later date. Then we make sure that our advice is tailored to the results and also what the person's reported back to us. So it's a real opportunity to speak to people about drugs and drug use in a non-judgemental and safe, confidential space without fear of judgment. What we found at our most recent festival is nearly 40% chose to use less based on the results and the information that we'd given them. So we're seeing some really great healthcare outcomes of people deciding to do something differently to what they would have done if they hadn't visited the drug checking service.
Sarah, for people who might feel nervous about using the drug checking service, what advice do you have for them?
First and foremost, here in Victoria, the law has been changed. So you are safe from prosecution when you bring a personal amount of drugs into a drug checking service. The second thing is it's confidential and anonymous. So legally protected, confidential and anonymous, and you can choose what information you give us. So Paul, some people are concerned that drug checking may encourage drug use. How do you respond to these concerns?
The evidence is from around the world where there's been many drug checking sites, both based at festivals and fixed sites, that it doesn't increase the use of drugs. We know that this helps people to reduce harm to people and enables people to be connected with health services. And that's really what we want to start that conversation for people to be able to say, I can seek out services and not be judged, and get the supports that I need to.